What's it like to be a CEO of a company working on a disease that your child has? It must be, being the CEO of a company is uniquely challenging. Just being a CEO of a company, right? Compounding that with the race to help your child, I can't fathom. What's that like?
Yeah, so it's definitely, as you said, being a CEO is not easy, especially the markets that we've had in the last few years, especially in biotech. At the end, as I tell people, look, I come from a technical field, from management consultant, and say, look, if you're developing software, you run into a bug in the code, you put two programmers to fix it, and you fix it.
Yeah.
Here, it's biology. Many times it doesn't work, and you don't know why, so you have to go back and work on it. So that part is pretty tough. If you add to it the pressure of developing a drug for your kid, I think you have a lot of goals that pulls you and stakeholders in many different ways. Of course, what I told people is one of the main things that you do when you start a company is know why you're doing it. If you're doing it to make a lot of money, you're doing it because you want to be independent, you do it because you want to cure a child, that's going to drive many of your decisions. Which money you raise, from here you raise it. I mean, it has to be investors that are going to support you in your mission. But many times, if you run into an obstacle in your main program, you're the one that's going to cure your child, you have to make the tough decisions.
Yeah.
I get it, that's the one for my child, but it didn't work this time. So what do I do? And at the end, you have to respond to investors and stakeholders.
Yes.
And you have to make the tough but right decisions. And what I tell people, so you think that you only report to your board, but we were giving a talk years ago at Bio, and somebody asked me, how do you separate your personal from your professional life? I said, I don't. Because every time I get home, my kids ask me, Daddy, have you cured Natasha? What do you do today to cure Natasha?
Yeah.
So if you think that we only report to our board, we only report to our family also.
Oh, yeah.
And other parents that are asking,
They're tougher than your board.
Oh, yeah. They're asking you, how is it going? When are you going to get this cure to our patient?
Yeah.
But again, for me, it's managing all those, many times conflicting priorities. And sometimes you just have to pivot to a different program, even if it's not the one that you want to work on. And it's happened to us. I mean, luckily we were able to pivot back, but for some time, you have to follow the data. And if the data is looking much stronger in a different program, you have to pivot. You want the company to survive, you can develop the platform, develop the technology, and then you can always go back to your original mission.
Yeah.